Call first Graham Day, to be followed by Paul Sweeney. Up to 4 minutes, Mr.
Thank you, President Officer. I want to begin with a few thank yous. Firstly to Michael Mara for bringing this incredibly important topic forward for debate. And secondly, to the Minister for setting up the Independent Oversight and Assurance Group. Because without that intervention, I seriously question whether we'd have seen any meaningful progress made in addressing the state of mental health services provided by NHS Tayside. But with due respect to Mr Mara and Mr Stewart, however, the biggest thank you must go to the Independent Oversight and Assurance Group for the job they have done. I had the privilege of meeting with Fiona Lees and her team during their work, and I don't mind admitting I was hugely impressed, not only by their commitment and their approach, but more importantly, their candour. They answered every question I put to them in a way which left me reassured that these were people who intended to leave Tayside's mental health services in far better shape than they found them, and they weren't going to be fobbed off or kidded by cosmetic improvements. And that's why, like others, I have every confidence in what their final report says, good and bad, is credible. Presiding Officer, I must admit initially I was a little conflicted about how I viewed the picture the report paints. I wanted to take heart from the progress highlighted. But the more I reflected on it, the more I came back to this. As Michael Mara has alluded to, the Oversight Group operated for a year. Prior to that, NHS Tayside had ample opportunity to drive the progress demanded by Professor Strang, first of all in his initial report, and then the follow-up report, the progress report in June 2021. So when I look at areas still requiring attention, I can't help but feel deeply disquieted that we are not far further forward. And you do wonder what it will take for NHS Tayside to get its house in order. The report notes, for example, and I quote, some important areas relating to workforce still have a long way to go. There is also an urgent need to improve some aspects of governance and public performance reporting as a means of developing a more open and transparent culture and building trust among the communities of Tayside. Presiding Officer, why on earth are the group still having to highlight a need for those at the top to properly support and lead a highly skilled and committed staff to ensure they can do their jobs properly, not to mention involving them in major decisions of service delivery? And why hasn't transparency and rebuilding trust and confidence within that wider community already been placed at the heart of everything the board does around mental health? Is it any wonder that NHS Tayside has the worst record for recruiting general adult psychiatry consultants in Scotland? When these skilled individuals are in such demand, why would they choose to work for a board whose reputation in the field is as NHS Tayside's is? Yes, progress has been made, but there remains much more to do to improve the mental health offering and rebuild trust, and in so doing, hopefully make recruitment earlier. For me, Presiding Officer, there are two very obvious questions as we look to the future. Firstly, how confident can we be that the momentum for change will be maintained? Secondly, how will progress or lack of progress be monitored from here on in? How will NHS Tayside's feet be held to the fire? As the MSP for Angus South, I have confidence about the intent and the direction of travel around community mental health service provision in that part of Tayside. I've engaged directly with the Angus Health and Social Care Partnership on that and been able to make some suggestions to ensure all cohorts are captured. I believe they're on the right track. I wouldn't expect anything else, to be honest, under the leadership of Gail Smith. But the Angus situation is inextricably linked to that of wider Tayside. We need, for example, a decision about single-site provision. I understand that the lease on Carsview is up in around 18 months' time, and the physical environment at Strathmartin has been raised as a source of concern for patients and staff. So, having praised the Minister for the action he took in setting up the group in October 2021, I also look to him in closing to hopefully provide assurance that there will be no backsliding in Tayside now the Oversight Group has produced its final report, and that we will emerge from the mess that he, following on from initial work set and trained by G. Freeman, has set about sorting, with mental health services provided by NHS Tayside that properly and fully meet the needs of those who require them. Presiding Officer.